Assalamu alaikum wa rahmatullah. I'm Dr. Alaaeldin Bashier, and I'd like to welcome all of you to DAR conference. Today, I'm going to discuss the changes in renal function in patients with and without diabetes during fasting in Ramadan. Basically, my agenda is to go through different studies that looked at changes in renal function during Ramadan in diabetic and non-diabetic patients. And I'd like to start by reminding you that the risk of fasting in the month of Ramadan in patients with chronic kidney disease is basically related to a couple of factors. The first important factor in those patients is that patients with diabetes, and especially those with chronic kidney disease, are more likely to develop dehydration that will increase the risk of thrombosis, and they might develop as well hypotension. All these factors, dehydration, hypotension, and thrombosis, might also result in acute kidney injury in someone whose kidney is already affected. The other side of it is if the patient is diabetic, diabetic patients as well as are likely to develop diabetes-related issues or complications during the month of Ramadan, and these include either hypoglycemia or hyperglycemia and ketoacidosis. So what are the studies that has looked at kidney functions during the month of Ramadan? And I'd like to start with looking actually at patients who had a normal kidney function and ask the question, does fasting the month of Ramadan increases the risk of admission due to acute kidney injury? And if you look at this study, this is a recent study that is published in 2022 that looked at admissions to hospital with acute kidney injury. This is a retrospective study, single center. It looked at adult patients that were admitted to emergency department during the month of Ramadan, and over 2-year period. That was in 2016 and 2017. And because the numbers are huge, they tried to run logistic regression and to try to randomize patients to do a propensity cohort matching to try to get to the outcomes. The study actually found that acute kidney injury occurred in almost 20.4% in non-fasting patients compared to fasting patients. So fasting patients had a lower risk actually of significant kidney injury, acute kidney injury, and that was significant. And when they did a multivariate logistic regression analysis, they found that there are as well predictors for acute kidney injury. So just to remind you, all those patients were patients who had previously normal kidney function before Ramadan, and then they developed acute kidney injury during the month of Ramadan. They are patients with different risk factors or comorbidities. So they found that what predicts acute kidney injury in those patients were the hypertension, if they have associated hypertension, or a history of acute kidney injury. Actually, a history of a previous acute kidney injury has increased the risk of developing another acute kidney injury 2 times, 2 times than other patients. If you look at the odd ratios in the fasting group, it was around 8.6 compared to around, the odd ratios, they were around 5.25 and compared to 2.3 in the non-acute kidney injury patients. Liver cirrhosis also increased the risk of acute kidney injury in those patients. Actually, when they did also the analysis, as I showed you initially, that patients who were fasting had less risk of acute kidney injury. In fact, with the analysis, they found that fasting was even protective in patients with specific comorbidities, specifically diabetic patients, dyslipidemia, and those with cardiomyopathy and heart failure. The risk of having acute kidney injury is less if they have been fasting. And the authors concluded from this study that there is a strong reduction in the risk of developing acute kidney injury if the patients were fasting, particularly in patients with specific comorbids. If they fast, they do benefit better. So this is the first study that looked at patients with normal kidney function and the risk of acute kidney injury during Ramadan. Another interesting study that actually differed from other studies in the fact that the parameters of kidney function were checked before, during, and after Ramadan. All the previous studies actually looked only before and after Ramadan. So in this study, patients' data were collected retrospectively before Ramadan. During Ramadan, when they visited the clinic, we had another measurement for other many metabolic variables, but I'm concentrating here on kidney function. And then 3 months after Ramadan. And I'd like just to show you here, and I highlighted that changes in creatinine. Before Ramadan, serum creatinine ranged between 0.5 to 0.8. It has increased to 0.6 to 0.9, and this change was significant, by the way. A change in mean, although the mean is the same, but if you look at the difference, 0.5 to 0.8 became 0.6 to 0.9. Statistically, it was significant change. And after Ramadan, still the same mean, but there is still a statistically significant difference. So if you look at it, patients' creatinine is normal. It increases during Ramadan and then it goes back to normal. So, and those are normal patients who didn't have previous kidney disease, but they are diabetic. So the first study I showed here, it showed patients with the risk of acute kidney injury in non-diabetic normal kidney function patients. This is a study in patients with diabetes with normal kidney function. Now, what about patients with, before that, again, I will just carry on with this study just to show you the changes in serum creatinine when I compare. This is called ABCD study to other studies. You can see in the ABCD study, there is a significant change, while the DAR-MINA in type 2 diabetes did not show any change in creatinine. And when we compare the Optimum Care Dubai, there was no significant difference. So this is a study is showing a difference in creatinine before, during, and Ramadan, basically because we did check during the month of Ramadan that slight deterioration in kidney function. And this is the conclusion of the authors, that the study suggests that there are many changes in the parameters, and it is not associated with an increased risk to their glycemic control. Now, what about patients with chronic kidney disease? If you look at all previous studies that looked at kidney function, some of them showed deterioration in kidney function. They either measured the eGFR or tubular injury markers, like the study in 2007 showed worsening kidney function because of tubular markers. I'm not going to go through this because all these were actually discussed in previous years. I'm going to go to new studies. So there are just a summary of this. There are studies that showed worsening in kidney function, and there are studies that showed fasting does not affect kidney function. And I'd like to remind you that these studies were not specific to diabetic with CKD. They were just patients with CKD. Some of them had diabetes, some don't have diabetes. And the sample size in all these studies were actually very, very small. So studies, some of them showed benefits for fasting. Some of them showed worsening in kidney function because of fasting. So we didn't have consistent data. What is new is a study in 2018 by Shadia Hassan. And in this study, they tried to look at the dehydration in patients with CKD from stage 2 to stage 4. And this time they checked the blood, the markers of dehydration before, during, and after the month of Ramadan. And they have noticed that there is a slight deterioration in kidney function that improves immediately after Ramadan. As I said here, there is a significant increase in creatinine and parameters of dehydration that improved after Ramadan. And the conclusion of the authors that although there is a slight increase in serum creatinine and renal parameters, it doesn't affect the decision on whether to fast or not, because it actually goes back to normal after the month of Ramadan. So what about CKD? There are two studies that were dedicated to stage 3 chronic kidney disease. They looked at both renal and diabetes outcomes, and I'll just focus on renal outcomes. This is the first study conducted in our hospital, where we looked at serum creatinine before and after the month of Ramadan, and we didn't see any significant change in serum creatinine, although they were doubling of the hypoglycemia during the month of Ramadan, measured by the freestyle Libre sensor. The other study was conducted in London by Chaudhary group, and they looked as well at the risk of acute kidney injury, and they found that there is no change in serum creatinine and there are no admissions with acute kidney injury. Now, one last look, if we look at this study conducted in Pakistan, it's an interesting study that looked at patients with stage 3 and 4 chronic kidney disease. And what they did, they compared patients to themselves and they compared fasting to non-fasting. So there is a sort of multiple comparisons. And I'm going to show you here that it included patients with stage 3 and stage 4 chronic kidney disease. They excluded malignancy, advanced heart disease. And in this study, they looked at the serum creatinine during the month of Ramadan, and they compared fasting to non-fasting. But initially, if you look at the fasting group and non-fasting group before Ramadan, the fasting group before Ramadan, mean A1C was 1.5. It has improved to 1.4 during the month after Ramadan. So there is an improvement in the fasting group. While in the non-fasting group, if I can show here, the non-fasting group, the serum creatinine was actually higher, 1.69, and improved to 1.86. Now, I would like you to see the comparison horizontally. The non-fasting group had a higher baseline in the pre-fasting compared to fasting group. And that means people who don't fast, they know that they have a worse actually kidney function. So it was significant, there was a significant difference. And again, in the after breaking the fast, actually the non-fasting group, the creatinine has worsened while dose fasting has improved. And this is, you read it that way, vertically. And this is again a significant difference. So what the authors concluded here is that fasting in patients with stage 3 and 4 is well tolerated, and it did not disrupt the kidney function that much. And actually they found it might be associated with an improvement in kidney function. Just one last word about dialysis patients. In dialysis patients, checking kidney function is not actually helpful, because they go for dialysis and creatinine increase and come down, so you cannot measure it over a month. So this is a recent study again in 2019, published in PLOS ONE. It's from Israel, and in this study, it was conducted in Palestine, and they had three groups. So this is there is control groups in this study. They took the first group, people who did not fast; the second, those who partially fasted, and those who fasted all the month of Ramadan. And it included a good number of hemodialysis patients. And in this study, they looked at data before 1 month before Ramadan and 2 months after the month of Ramadan. They found what we do in hemodialysis. We look actually at the interdialytic weight gain, and it found in this study that patients who did fast during the month of Ramadan actually had an increase in their interdialytic weight gain, and those who fasted full month, they had even more weight gain. So those who did not fast did not have significant increase in the weight. Those who fasted for partially, they had an increase in weight, while those who fasted full month, they had even more increase in the weight. So it indicates that fasting is associated with an increased interdialytic weight gain. This is another study that is conducted in Malaysia. It has no control group, and it included around 87 patients on hemodialysis. And they found that actually the other way around, the interdialytic weight gain and phosphate has improved after Ramadan in people who fasted during the month. So this is the just summary of the new data that looked at the kidney function in patients with changes in kidney function in normal diabetic and diabetic with CKD. So just to summarize it, normal people with normal kidney function, fasting confers protection against acute kidney injury. There is in the ABCD study, there is a slight increase in diabetic patients in creatinine that improves after creatinine. In stage 3, we didn't see in the studies any changes in kidney function, while another study that has checked during the month of Ramadan showed had mild increase in serum creatinine that improves after the month of Ramadan. I'd like to thank you for listening, and I'm open to any questions. Thank you very much.